This patient is a 45-year-old female with a history of hypertension, tobacco use, and primary biliary cirrhosis who presents to the ER for fever and productive cough and is being admitted for pleural effusion requiring thoracentesis. Her INR is 3.2. She is not on any anticoagulation. Pulmonology would like you to lower the INR ASAP. So what do you want to do next? Do you want to check a vitamin K level? Do you want to give oral vitamin K, subcutaneous vitamin K, IV vitamin K, do A, then B, C, or D, just C or D, or B, C, or D. So a lot of different options. I'm going to give you 20 seconds to think about it and commit to an answer. All right, so I'm going to make the argument. The answer is C or D. So give sub-Q vitamin K or give IV vitamin K if you have to. Let's review some stuff. So choosing wisely actually says do not test vitamin K levels unless the patient has an abnormal INR and does not respond to vitamin K therapy. So in this particular case, we didn't have a pre-existing, or we didn't actually try vitamin K, so it wouldn't make sense to check the level. So don't do that. Most of you are probably not doing that anyway, so nice job. Let's talk a little bit about vitamin K, which is also known as phytonadione. So it is fat soluble, therefore it requires bile salts to be excreted into the gut so it gets absorbed. So if you don't have bile salts being excreted into the gut, you minimally absorb vitamin K. This patient has primary biliary cirrhosis, so that can present an issue. So because they're PBC, we have to do something else. And so orally, if you give it, it won't get absorbed. So you have to do either IV or sub-Q. There are reportedly elevated rates of anaphylaxis with IV, so everyone likes to recommend sub-Q. I will say that the reports are very rare. However, if you can avoid it and it kind of works the same, why the heck not? So sub-Q is probably the way to go. The only other thing is there's concern for erratic absorption through a sub-Q route. Also, not super clear if that's truly the case. So you have to weigh the risk of anaphylaxis with IV versus the erratic absorption through a sub-Q route. If you can get away with sub-Q or oral, always do that because this whole anaphylaxis business seems like a bad thing. So what are some dosing strategies that we have? Well, for patients that we are not attempting to reverse the effects of a vitamin K antagonist, you use vitamin K. So if someone comes in with an INR that's elevated because of warfarin, would you use it? No. And so if you have an elevated INR from warfarin, there's a whole host of things you can do. So these guidelines are now actually almost 10 years old because time continues to move forward at a relentless pace. And so depending on your INR and if you're bleeding, you would do one of the following things. You don't have to memorize this. This exists in all the guidelines. So whenever you're unsure, make sure to up-to-date it. So one thing that we can kind of go over here, and we're already almost done, it's even shorter than 5 minutes, is all the different strategies we have. Now, remember that vitamin K is fat soluble. So without bile salts, you will not be able to orally enterally absorb it. So oral vitamin K does not work unless you have bile. Here's a table I made that kind of explains things a little bit better. So let's start on the left-hand column. It's either needs vitamin K repletion or needs INR reversal. So depending on your needs, you should pick a particular route. The next question you must ask, is there biliary tree pathology or is there no biliary tree pathology? So if you just need vitamin K repletion and there's biliary tree pathology, do sub-Q. There's no biliary tree pathology, do oral. If you need INR reversal and there's biliary tree pathology, do IV. If you need INR reversal and there's no biliary tree pathology, you can use oral. As always, all of these slides are available at the link above. And with that, I will take any questions. All right. Happy Friday, everyone. Everybody stay safe. Thanks for working so hard in the hospital.